This is kinesiological analysis of a baseball swing. Here we have John Oliver, a junior outfielder from Kansas Wesleyan University. The swing is broken up into 4 phases: the stance, the load, the launch, and the follow-through. Here in the stance phase, we see that the batter's feet are shoulder-width apart, the knees are flexed, the hands are in a comfortable position, and the center of gravity is right over the midline. Moving into the loading phase, this consists of 5 movements: the backward movement of the shoulders and arms, the backward rotation of the spine, the beginning of the timing step, the cocking of the hips, and the cocking of the wrists. The main muscles associated with the backward movement of shoulders and arms are the pectoralis major, coracobrachialis, latissimus dorsi, and teres major. The left shoulder is abducted and the left scapula is protracted by the serratus anterior and the trapezius, which causes the shoulder to move into a shrug position. Occurring simultaneously is a stretching motion of the posterior deltoid, rhomboids, teres minor, and infraspinatus. The right arm is abducted by the supraspinatus and middle deltoid, and the scapula is elevated by the trapezius. Contraction of these muscles on the left side of the body loads the antagonistic muscles on the right side of the body, which are the latissimus dorsi, teres major, serratus anterior, and pectoralis major. Backward rotation of the spine is seen when the chest and abdomen turn away from the pitcher, which is caused by the external abdominal oblique, rotatoris spinae, and multifidus spinae. After the spine rotates, a small step with the front leg occurs, which is known as the timing step. The left leg is lifted up, and the muscles that are responsible for this are the hip extensor muscles, knee extensor muscles, and the calf muscles. The hip extensor muscles at the acetabulofemoral joint include the gluteus maximus, semimembranosus, semitendinosus, and the long head of the biceps femoris. The knee extensor muscles at the tibiofemoral joint include the quadriceps muscle group, which consists of the rectus femoris, vastus lateralis, vastus medialis, and vastus intermedius. The calf muscles at the talocrural joint include the gastrocnemius and the soleus. The cocking of the hips occurs when the front leg is lifted off the ground and the hips rotate towards the catcher. The muscles that are responsible for this are the gluteus medius, gluteus maximus, superior gemellus, inferior gemellus, piriformis, obturator internus, obturator externus, and quadratus femoris. The last aspect is the cocking of the wrists, and this occurs at the radiocarpal joints, and the right wrist is pronated by the pronator teres and pronator quadratus, while the left hand performs radial deviation from the extensor carpi radialis longus, extensor carpi radialis brevis, and flexor carpi radialis. The timing step helps to get the weight on the backside before lowering the foot to the ground, and this translates into the launching phase. The launching phase consists of 5 movements as well, which are the continuation of the timing step, the opening of the hips, forward rotation of the spine, pushing and pulling action of the arms and shoulders, and the guiding action of the hands on the bat. Continuation of the timing step occurs when the front leg moves towards the ground. Flexion of the back hip and back knee and back ankle dorsiflexion occur at this. The muscles that contribute to this are the superior gemellus, inferior gemellus, piriformis, obturator internus, obturator externus, quadratus femoris, gluteus medius, and gluteus maximus. We also have work from the internal hip rotators, which include the gluteus minimus, gluteus medius, and the tensor fascia latae. The opening of the hips refers to the movement when both hips face the pitcher near the point of contact with the baseball. The turning of the back hip is caused by the external hip rotators, which, as mentioned before, include the gluteus medius, gluteus maximus, superior gemellus, inferior gemellus, piriformis, obturator internus, obturator externus, and quadratus femoris. At this point in the swing, we know that the hip and knee are not fully extended and the ankle is not completely plantar flexed, because this would be insufficient swing technique. The muscles involved in hip extension are the gluteus maximus and hamstring group, which are the semimembranosus, semitendinosus, and long head of the biceps femoris. The muscles involved with knee extension are the quadriceps group, which is the vastus medialis, vastus intermedius, vastus lateralis, and the rectus femoris. And the muscles involved with ankle plantar flexion are the calf muscles, which are the gastrocnemius and the soleus. As this is occurring, the player's front knee is straightening, and this is caused by a force in the left hip that results in a short, compact, and explosive pivoting action across the player's pelvis that carries up the spine. This forces the left hip backwards and contributes to the left hip opening up towards the pitcher. Forward rotation of the spine is the exact opposite of when we mentioned backward rotation of the spine. And the muscles responsible for this are the external abdominal oblique, multifidus, and rotator spinae. The pushing and pulling action of the arms at this point in the swing are the exact opposite of when they were in the load swing. And the muscles that we used here were the posterior deltoid, rhomboids, and trapezius, as well as the teres minor and infraspinatus. These muscles in the left arm are pulled through the swing as they go to contact. And this also contributes from elbow extension, which is from the triceps brachii and anconeus. The right arm, which was abducted, is now pushed through the swing from the teres major, latissimus dorsi, pectoralis major, and serratus anterior. We can see that the player's right hand moves into an L shape at this point. So we see that the latissimus dorsi and teres major contribute to this, while the elbow supinates from the biceps brachii and the supinator. The end of the bat is then pointed forward towards the pitcher from the contraction of the pec major, serratus anterior, anterior deltoid, and coracobrachialis. The last aspect, which is the guiding action of the hands, is incredibly important since the hands are what holds on to the bat. This is made possible by 7 muscles in each hand and 3 muscles in each forearm. The muscles that contribute to hand grip are the flexor digiti minimi brevis, opponens digiti minimi, opponens pollicis, flexor pollicis brevis, adductor pollicis, palmar interossea, and first dorsal interossea. And the muscles in each form are the flexor pollicis longus, flexor digitorum superficialis, and flexor digitorum profundus. Here we see the left arm moves into a pronated position, while the right arm finishes in a supinated position as they transition into the follow-through phase, which begins here. The muscles that help to extend the follow-through includes the continuation of rotation taking place at the hips, the pulling and pushing action of the arms on the bat, and a rollover of the forearms. Since the player's front leg stiffens, the muscles that help to do this are the vastus lateralis, vastus medialis, vastus intermedius, and rectus femoris. This causes the chest being visible to the pitcher as well as the hips. And this is caused by the lateral spine rotators, which we noted were the external abdominal, oblique, multifidus, and rotator spinae. In terms of the arms, the posterior deltoid, rhomboids, trapezius, teres minor, and infraspinatus are all used to push the left arm through. The right arm is pushed from the pec major, serratus anterior, coracobrachialis, and anterior deltoid. The forearms move into a rollover position where we see that the right arm moves from supinated to pronated and the left arm moves from pronated to supinated. The muscles that contribute to this are the pronator teres and pronator quadratus, and for the left, the biceps brachii and the supinator. This is the main anatomy of the baseball swing. Here we'll watch one in full speed. It's important to know that the swing itself should be very safe and not a hard movement. It should be clear for coaches to analyze swing errors that they can see in the movement. In the case of John here, his swing for the most part is fairly good. The one thing John tends to lack sometimes is not getting that front leg all the way straight. During his follow-through phase. But overall, this is the correct way to analyze a baseball swing. Thank you for watching.